Hello everybody, this video will explain the questions we had in the mock test. So there are about 10 questions which I will explain in this video. So and again, you will see that this mock test has a mix of all the questions, has the mix of all different types of questions which we have covered in in other videos. So let's get started with question number one. In question number one, we have how many milliliters of 1 in 5,000 solution of boric acid can be made from 50 mils of 0.4 solution. So if you again pay attention to the wording of the question, you can see that it is a very simple C1, V1, C2, V2 question. So we have to make something from 50 mil 0.4. So that's our original or the starting solution, and the strength of that is given. So that's a starting solution, and we have to make 1 in 5,000 solution, and we have to find out the volume, that how much of that solution will be made. Now again, you will notice that the concentration on both sides is different, so we have to make sure that the concentration on both sides is the same. So let's convert 1 in 5,000 into percentage, because I find it easier to work with the percentages. So let's convert 1 into 5,000 into percentage, so that we'll have the percentage on both sides. So 1 in 5,000 means 1 gram in 5,000 mils, but percentage is out of 100. Percentage is out of 100 mils. So if 5,000 mils has 1 gram, 100 mil will have 0.02 grams. So that means 1 in 5,000 is actually is equal to 0.02%. Okay, so now we know the percentage, and we can plug it in the equation, and we can work on. So that will be so that would be 1,000 mils, and that's the answer. Moving on to question number 2. Here we have dopamine 200 milligrams present in 500 mils of the solution, normal saline, and the infusion rate or the dose mentioned is 5 mcg per kg per minute, is ordered for a 155-pound patient. That's the weight of the patient. What is the final concentration of the solution in mcg per mil? So if you look at the wording of the question, we only need to find out what is the final concentration of the solution. Okay, we are not concerned about the weight of the patient or even the dose. So that information all is unnecessary. So this is just given to confuse you. So we don't need to use that in the information. So all we know is that we have 200 milligrams present in 500 milliliter of the infusion solution, and let's convert that into milligrams per mil first. So if 200 milligram present in 500 mils, so we have 200 divided by 500, so we have 0.4 milligrams per mil. That's the concentration of the solution we have, and we have to find out the final concentration in mcg per mil. So let's just simply convert this milligrams per mil into micrograms per mil. So again, I'm going from milligrams to micrograms. That's going from a bigger unit to a smaller unit. So the decimal should move towards right by 3 places. So that would be 1, 2, 3, and that would be 400 mcg per mil. So that's the answer. Moving on to question number 3. Here we have a patient with body surface area of 1.66 meters square. The patient has been prescribed the drug at a dose of 30 milligrams per meter square orally once a day for 5 days. If the tablets are available as 10 milligrams, then how many tablets would you supply for 5-day course? So in this type, because it's a tablet, so we have to find out how many tablets the patient. So we have to find out how many tablets the patient will need in 1 day as a dose, and then we'll just simply multiply that by 5 days. Okay, so again, as I said before, that's for some drugs on the doses are based on the weight. So for example, that would be something milligrams per kg. So that's an example of the dose based on the weight. But here we have got the example of the drug which is dosed as milligram per meter square. So it's one of the drugs which has the dose based on body surface area. So body surface area of the patient is given, so we just have to multiply the weight with it. So that's 30 milligram per meter square. So that means 30 times 1.66. That's the dose I'm calculating. So the dose turns out to be 49.8 milligrams. And the tablets, I know already that they're available as 10 milligrams. So let's just, for the sake of simplicity, round it up to 50 milligrams, so that the patient will need 5 tablets in one dose, because that's a oral dose once daily. So dose per day dose, the patient will need 50 milligram or 5 tablets. So for 5 days, we just need to simply multiply it by 5. And 25 tablets the patient will need for a 5-day course. So that's the answer. Moving on to question number 4, we have a patient who has been started on Remicade IV infusion 3 months ago for rheumatoid arthritis, and the dose has been increased to now 4.5 milligrams per kg. The patient weight is 50 milligram. The Remicade injection is available as 100 milligrams per 10 ml, and which should be diluted to final volume of 250 ml, which is then administered over 3 hours or 120 minutes. Calculate the infusion rate. So we have to just calculate the infusion rate in this case, and we have been given the total volume of the we have been given the total volume of the infusion. Total volume of the infusion is 250, and we have been given the time over which we have to infuse it, so that over 120 minutes. And we have to find out the infusion rate in mils per minute. If you look at this, we don't need to make use of a lot of information which is given in the question. So this is an example of the question where a lot of information like the weight of the patient, and the dose and the concentration of the solution that is given just to confuse you. And actually we don't need to use those numbers in the calculation, because we simply need to find out the infusion rate, and we have been given the total volume of the infusion and the time over total time, and just we can simply calculate the infusion rate. So that will be 250 mils we have to give over 120 minutes. So simply 250 divided by 120 will be 2.08 mils per minute. And we can just simply round it to simply round it to 2 mils per minute, and that's the answer. Question number 5, we have a 10 ml solution was diluted to 1 liter of 1 in 4,000 solution. What is the concentration of the original solution? So we have been given the volume of the solution 10 mils, and we diluted it to 1 liter of 1 in 4,000 solution. And we're asked to find out what was the concentration of the original solution to start with. So again, it's a simple C1V1 C2V2 question, but the units on the different sides are the difference. So let's get the units sorted out first. So that would be 10 mils. Percentage strength I have to find out from of the original solution. Let's convert this 1 liter into 1000 mils. And 1 in 4000. No, let's find out what is 1 in 4000 in percentage. So 1 in 4000 means 1 gram in 4000 mils. And I'm trying to convert this into percentage, and remember that percentage is out of 100 mils. So if 4000 mil has 1 grams, then 100 mils will have 1 divided by 4000 times 100, 0.025. So 100 mils will have 0.025 grams. In other words, 1 in 4000 is equal to 0.025%. And simply solve this equation. So that will give me 2.5%. And that's the answer. Moving on to question number 6, we have how much of a sterile potassium chloride concentrate, 5% weight by volume, you would need to add to 500 mils of the bag to produce 10 millimoles of the solution. So basically what's happened here is that how much of 5% solution, how much of the 5% solution I will take and I will add it to 500 mils of the bag, so that the concentration of potassium chloride in it is 10 millimoles per liter. So again, if you look at it, it's a form of a C1V1 C2V2 equation, and we have to find out the volume of the original solution which we have to take. But here the concentration is given in millimoles per liter on the other side, and this is the concentration I think we have not come across before in C1V1 C2V2 equation. So let's try and convert this millimoles per liter into percentage also, because it's easy to work with the percentages, and then we will have the concentration in percentage on both sides. So let's try and convert this 10 millimoles per liter into percentage first. Remember, the equation for millimoles calculation is, that will help me, I'm trying to find out weight in milligrams because that will help me convert it into the percentage. So millimoles given here is 10. Weight in milligrams I'm trying to find out, and molecular weight of potassium chloride is 74.5. So that's 745 milligrams. Okay, so now from this I know that 745 milligrams is present in 1 liter, because it was a liter we started with. Okay, so I know now that 10 millimoles per liter is equal to 745 mils in 1 liter. So or we say 1000 mils. So now I know that if 1000 mils has 745 milligrams, then 100 mils will have 74.5 milligrams. But remember, the percentage is grams, number of grams per 100 mil. So actually I want to find out how many grams are present in 100 mil. So let's just convert this into grams. So going from smaller unit, going from milligrams into grams, going from a smaller unit to a bigger unit, the decimal will move towards right by 3 places. The decimal will move towards left by 3 places. So that will be 1, 2, 3, and that will be 0.0745 milligrams. So 100 mil will have, that would be 0.0745 grams. So that means in the concentration of the solution in percentage is 0.0745 percentage. So now I know that this 10 millimoles per liter, is equal to 0.0745 percentage. So let's plug this in the equation and try to solve it. Um, 7.45 mils. So that means I will take 7.45 mils of this solution, 7.45 mils of 5% solution, and I can when I will dilute it to 500 mils, the final concentration of that will be 0.745%. So it was a simple, you could see that it was a simple C1V1 C2V2 equation application, but the concentration was on one side was given as 10 millimoles per liter. So I tried to convert that into percentage first and then carried on from there. Again, there was one thing to highlight is that it's when you read the question first, it's important to figure out that it can be simply solved with C1V1 C2V2 equation, because the question is just asking how much of this 5% solution I would need to dilute it to 500 mils so that it will have the concentration of this. So in this case, I was given the concentration in 10 millimoles per liter. I was given the as a 10 millimoles per liter, I was given the concentration and the volume of the final solution, and I was given the concentration of the initial solution, and I was asked to find out the volume of the initial solution. Let's move on to question number 7 quickly. We have a junior doctor who prescribed flucloxacin 25 milligram per kg 4 times a day for the prevention of Staph aureus for a 10-year-old child. The child weighs 32 kg. Calculate the daily dose for this patient in grams. So the dose is already given. It's a fairly simple question. 25 milligram per kg, and the weight of the patient is given. And while I'm doing this, it just came to my mind to remind you that in some SPLE questions, you might be given the weight in pounds. The doses are calculated as milligrams per kg. So make sure that you are able to convert pounds into kg and then work out the dose if the weight is given in pounds. So 25 milligram per kg, weight of the patient is 32. So it's 25 multiplied by 32. So the dose would be 800 milligrams. And it's given as 4 times a day because we have to find out the daily dose. So it's given as 4 times a day. So simply 800 times 4 will be 3200 milligrams per day. So that's the daily dose. And also we have to find out it in grams. So let's just simply convert this 3200 milligrams into grams. So 3200 milligrams will be equal to, remember I'm going from a smaller unit to a bigger unit. Decimal is here, which will move towards the left by 3 places. So that's 1, 2, 3, and that will be 3.2 grams per day. And that's the answer. Moving on to question number 8, we have a prescription for Dermovate ointment for 0.5% weight by weight. What is the amount of liquid paraffin I would need to add to 2% weight by weight Dermovate ointment in order to prepare 10 grams of Dermovate ointment 0.5% weight by weight? So it's if you look at it carefully, it is again a simple C1V1 C2V2 question, but actually the question is asking about something else. What is the amount of liquid paraffin, which is the thing which I would dilute the active drug with? So let's apply C1V1 C2V2 first, and then we'll see what else the question is asking. C1V1 C2V2. So I have to make 0.5% of the cream, and I have to make 10 grams of it. 10 grams of this 0.5% I have to make. And the starting cream which I have to take, which I will dilute to make it, it will be 2%. So that's given here. So 2%, and let's calculate what would be the volume or the amount of this starting or initial cream I would take to make this preparation. So let's just simply solve this equation first. .5 grams. So that means I need to take 2.5 grams of this I need to take 2.5 grams of this 2% cream, and I will dilute it, and it will become 0.5% of 10 grams of the full cream. So if you see, the final volume of the cream, or the final amount of the cream, is 10 grams, right? So that's the final amount of the cream. But I'm taking but I'm going to take 2.5 grams of 2.2% cream to start with. And because I have to make it up to 10 grams, so simply 10 minus 25, so 10 minus 2.5, 7.5 grams. So that means I will take 7.5 grams of the liquid paraffin cream. So that means I will take 7.5 grams of liquid paraffin, and I will mix it with 2.5 grams of 2% cream, and the final product will be 10 grams, and its concentration will be 0.5%. Let's move on to question number 9. It's a very interesting question and a bit long calculation, so you just need to pay attention. We have a 60 kg patient here who has been prescribed 30 milligram per kg of epilim IV 400 milligram per 4 mils. Which one of the following is correct? So we have been given 4 options. So it's like an MCQ. So epilim dose for this patient is 0.18 grams. So let's calculate what's the dose of this patient. Dose is 30 milligrams per kg, and we have been given the weight of the patient. So that's 30 times, weight of the patient is 60. So 30 times 60 is 1800 milligrams. And in milligrams, it would be 1.8. So the dose of the patient given is 1.8. So option A is saying the dose of the patient is 0.18. So that is incorrect. So A is wrong. Let's have a look at B. Volume of injection required for a single dose is 1.8 mils. So I have to give 1.8. Now I have to find out how many mils of the injection will contain this 1.8 grams of the dose. So I will simply make use of this information, which is the concentration or the strength of the injection. So if the strength of the injection, it is saying that 400 milligrams present in 4 mils, then 1800 milligrams from here will be present in how many mils? So that would be 4 divided by 400 times 1800. So that would be 18 mils. So that means the dose of 1800 grams, which I have to calculate, which I have to give, that will be present in 18 mils of this injection, and here it's given 1.8. So that's wrong as well. So B is wrong. Let's move to option C. It says if you need to produce 100 milliliter of the infusion, so that's the final volume of the infusion, then the amount of normal saline needed to produce will be 82. But actually, if you look at it, you will see that the amount of the drug or the amount of this injection I will take is 18 mils, right? Because this 18 mils is going to have this 1800 milligram dose. So I would take 18 milliliters of the injection, and in order to make 100 mils of infusion, I would add, to make 100 mils of infusion, how much I would add, how much normal saline I would add. So that would be simply 100 minus 18, that's 82. So I will take 18 mils of the injection and I will mix it with 82 mils of the normal saline, so that the final volume of the solution will be 100 mils. So I need to take 82 mils of the 100 normal saline. So that's what it's given here. So C appears to be the best answer at the moment. So but let's have a quick look at the option number D also. The number of vials required to prepare single dose would be, so let's just see this. So if 400 milligrams present in one vial, 1800 milligrams will be present in simply 1800 divided by 400. So I will need 4.5 vials. Because these are number of vials, so let's just round it up and make it 5 vials. So 5 vials, here it's given as 4. 4 vials are not going to provide the sufficient dose, so that means D is all wrong. So C is the correct answer here. Move on to last question finally of the mock test. Here we have the patient who is admitted to the hospital with an overdose of drug X. The plasma concentration of the drug at admission is 140 mcg per liter and the drug's half-life is 4 hours. Assuming that the absorption is complete and elimination occurs by first order kinetics, what will be the plasma concentration after 12 hours? So we have got the initial plasma concentration to start with, and we have got the final half-life of the patient, half-life of the drug, and we have to find out how much of the drug will be left after 12 hours. So when the patient came in at the starting concentration, it was 140 mcg per liter. So because it's first order kinetics, and assuming that absorption is complete, so after first half-life, 140 mcg will be reduced to half, so that will be 70 mcg per liter left. After second half-life, this 70 will be reduced to half, so that will be 35 mcg per liter. And after the half-life, this 35 will be reduced to half, 17.5 mcg. So after this is after first half-life, this is after second half-life, this is after third half-life, and every half-life is about 4 hours. So 4 hours, after 4 hours, after 4 hours, and 4 hours means after 12 hours. So I can see here that after 3 half-lives, or in other words after 12 hours, the amount of the drug, the concentration in the plasma concentration of the drug will be reduced from 140 mcg to 17.5 mcg per liter. So it's a fairly simple calculation, but you need to understand what's going on in the question. I hope that was clear.